Hey there, everybody. It's Dr. Chappell. Just wanted to give you an update of my personal view of the COVID-19 pandemic, how things are going. I'm family doc with Ogden Clinic in Farmington, Utah. Two questions that I've had recently of patients that I think are important. Number one is, wasn't this just the cold I had back in December or January? Probably was. I would say no, it was not. And my reasoning behind that is if coronavirus was the cold we all had back in December, January, or any time before now, we would see a lot more deaths than we have, a lot more ICU back then, and we did not. So that was some other bad cold, but not the coronavirus. Second question is, when do you think this will all end? It's terrible. It's having such a huge effect on the economy. It will end once we know that our resources of healthcare are secure, meaning that the death toll and the new cases that are coming on are flattening and going down. Once those are going down, then I'm assuming governments and people will be able to open things back up and continue life back at a new normal. Won't be the same. I would still suggest those that are high risk continue to practice social distancing, unfortunately, for a while, because this isn't going to go away. We don't have a vaccine. And that's really what it will take in the end, is we have to have a vaccine to get rid of the threat. And that's coming in a while. My last question is, I hear people saying, well, it's just like the flu. It kills people just like the flu. Why are we making such a big deal about it? It's the same as the flu. So how do you die from coronavirus? Coronavirus, it infects you through respiratory droplets that you breathe in mostly, or if you have contact from somewhere on your hands to your mouth after it's coughed out or sneezed out of someone else that has the virus. Once it infects your upper respiratory tract, you have cold-like symptoms. So that's the nose, the throat, back down to your voice box. And the swelling can cause changes in smell and taste, like we've heard about recently. If it gets lower, which most of the time it eventually will get there because you're breathing into your lungs, it causes severe acute respiratory distress. Or acute respiratory distress. So what is acute respiratory distress? Down into your lungs, there's a little tree, and down at the bottom of the tree are small sacs that open and close that have blood vessels around them. That allows for the oxygen in the sac to get through to the blood vessels. Those blood vessels are fed by the heart. With coronavirus, as well as the flu and other illnesses, the virus causes damage that increases swelling, and then your own immune system also attacking the virus causes more swelling. The swelling in your lungs makes it so that there isn't any more room for the air, and the oxygen can't diffuse past it. It also causes a backup of your pump. The heart is what's pumping the blood through the lungs, and when it has a backup, it stresses the heart. That's why more patients that have had heart attacks or other heart disease, or the elderly that have weakened hearts, have a less chance of survival. And that's because it backs up the pump, causing cardiorespiratory failure. So when you have respiratory failure or cardiorespiratory failure, that is how you die, is you're not getting enough oxygen to maintain life, and you're backing up your heart, your pump, and your heart fails. With coronavirus, this seems to be happening much faster than with other viruses. It is the same way that you may die of influenza, but it seems to be quicker and more deadly than influenza. We'll be getting more data on that, but just anecdotally, stories from nurses and others that are observing patients in New York and other areas in the US have said that it is very quick at times to go from doing well to not anymore. And that's how that happens with acute cardiopulmonary failure. You cannot live without your heart and lungs. And that's how someone would pass away from it. So I suggest doing everything that we have been told to do, the social distancing and staying home. In addition to that, getting ready for the continued coronavirus season, which is to work out, get your heart back in shape aerobically. So 30 minutes a day, 5 days a week of aerobic exercise, eating a healthy diet. You shouldn't be eating after 6 p.m. And decreasing your sugar and other things that you know are not good for you. And especially do not smoke or quit smoking, quit vaping or anything that's going to damage your lungs. We want to be as healthy as we possibly can for when we get this, so that our bodies can do well with it.